Hi, I'm Alinsod. I'm the inventor of ThermiVa. It's a pleasure to be with you today and to introduce you to a program that my friend Dr. Nabi Herrera is planning for the Philippines. She wants to put together a program called A Very Intimate Affair so that she can teach you all the different new modern technologies that are now out and available regarding radiofrequency treatments and other treatments for feminine restoration. This is an exciting, new, evolving field that changes every day, and Dr. Herrera has stayed on the forefront of medicine to learn all these new skills. She spent some time with me in the United States, and I have spent time with her, training her in these new fields. I hope you come and see her and participate in her training program. Dr. Herrera is the expert in this field. She has trained extensively with Dr. David Matlock and myself in the United States and have learned many of the new modern technologies to help your patients. She is the perfect resource for you for training in the Philippines. The FDA has come out with warnings to companies and to doctors and to patients about the potential risk of these devices, and Dr. Herrera is the expert to show you how safe and effective these treatments can be for the specific conditions and for the specific patients. You can't lose with this training program, and you can really expand your practice. This new awareness program put together by Dr. Herrera will teach you how to stay out of trouble, will teach you where to spend your money, and how to do it effectively without waste. Dr. Herrera will introduce you to various technologies such as radiofrequency treatments and the use of platelet-rich plasma for your patient's intimate and feminine needs. This is available for you to preview with Dr. Herrera and potentially add to your practice. Please give her a call. I encourage it. Thank you very much. So I'm often asked the history of how I came up with the idea for ThermiVa. It actually started in around 2005 when I started doing radiofrequency labiaplasty surgeries. I would use a very fine wire electrode, and I would use a ball tip electrode to help me with cautery and also to shrink tissues. So I would do a labiaplasty or a vaginoplasty, and I'd use radiofrequency, and I would see that it would tighten tissues. And so I thought, oh boy, what if we had a device that can tighten tissues without ablating tissues? So this was around 2005, and there were no devices available at that time. I knew there were some devices in Europe that were coming out, and in 2009 a device called ThermiVa made by Elman International came to the United States, and I made sure I got one right away. So when I did get one, I started doing more labiaplasties with it and using its little handpiece with a wide circular tip to tighten tissues, both externally on the labia majora, and I started using it internally inside the vagina too. I got my device around 2009, 2010, and at that time I met with the CEO of the company and their head of marketing, and we had a handshake agreement to develop a device for use in the vagina to tighten tissues inside the vagina without ablating tissues. So this handshake agreement led to what I thought would be development by 2010 of a vaginal device. It didn't happen. The company had a change of heart. They bought a laser company called Sandstone instead, and my project went away. Nothing happened to it. They told me that they weren't going to go forward with it. So for 3 years I started doing more and more of these treatments both in the vagina and in the vulva to tighten tissues. I didn't have anyone who would build me a vaginal device. So in 2013, a guy named Paul Hirschman came up to me and asked me if I'd be interested in designing something for vaginal use, a radiofrequency device that was non-ablative, that didn't burn tissues. So I told him, Paul, I've done it already. I have 3 years worth of data. It's safe to do. Yeah, I'd be happy to design something for you. So in 2013, we started negotiating a contract. 2014, I spent the year designing the ThermiVa device. We didn't really have a name for it yet. And by 2015, we got it approved by the FDA so that we can use it for dermatologic conditions. We chose to get approval for dermatologic conditions such as dry skin, loose skin, insensitive skin, and that was our whole approach. So what started in 2005 got another start in 2009, didn't get anywhere for 3 years. 2013, met Paul Hirschman, who had just started a company called ThermiAesthetics, and by 2014 I designed it. 2015 we got FDA approval, and right now we're in September of 2018. Guess what? In July of 2018 we actually got not just FDA approval, we finally got our patent, and the patent is now ours. My name's on it, and Paul's name is on it, and so is Kevin O'Brien. So that's how ThermiVa came about in a short nutshell. Thank you.